There are various methods of birth control available in the market. I think of date there are at least 15 types available, and what I will go through with you are the various options that you can consider, keeping in mind that not one method is suitable for everyone. One woman might find one a perfect fit for her and another might not. So we usually divide birth control methods into temporary and permanent. Temporary methods are a long list. Basically, the most common one which we've heard of are barrier methods, and namely the condom. The most common condom available is the male condom, but there's also another condom available in the market, which is the female condom. Basically, what these two methods do are create a barrier between the man's sperm and the woman's ovum and prevent both from meeting and hence exerting its birth control method. The advantages of a condom is that it's easily available. It helps to prevent sexually transmitted diseases. Is easy to use. The disadvantage is that compared to other methods, the failure rate is slightly higher, and some also say that it lacks spontaneity. The second temporary method of birth control is the oral contraceptive pill, which is also known as the pill. It basically contains two hormones, and what it does is it interferes with the thickness of the cervical mucus and prevents ovulation, and this is how it exerts its birth control effect. The advantages of the pill is that it's easily available, it's not costly, it's a pill so it's easy to take, and the other additional benefit is that if on top of needing a birth control method you have a hormonal imbalance or irregular periods, this oral contraceptive pill helps to regularize your periods and giving you a regular monthly bleed. The other benefit of this oral contraceptive pill is that with the newer brands in the market, even women who have acne problems can make use of the additional benefits of this oral contraceptive pill, whereby a majority of women actually finds the skin better and less oily while on the pill. The disadvantage of taking the oral contraceptive pill is that you do require commitment and to remember to take the tablets every day at roughly around the same time. Some women find that a bit of a hassle to take tablets on a daily basis. Beyond that, the side effects of the oral contraceptive pills with the newer brands in the market boasting lower dose of both the hormones are practically negligible. But some of the common symptoms that you can encounter is feeling nauseous, a bit of a breast tenderness, and some women find a little bit of a mood swing when they are taking these tablets. But generally, with the newer, lower dose preparations, it's quite tolerable, this oral contraceptive pills. The other method of birth control is also known as the progesterone-only pill, or it's also can be called as the mini pill. It only contains one type of hormone, and this is usually prescribed to women who have just delivered and are still breastfeeding. Why this is so is because if you take the pill which contains two of the hormones, sometimes women may find their breast milk supply declining, whereas with the progesterone-only pill, it doesn't affect your breast milk supply, and you can safely breastfeed while taking this method of contraception. The advantages and disadvantages are similar to the combined pill, and so is the side effects. There are various other birth control methods which contains hormones. For example, the vaginal ring, one in the market is available, and the benefit of this is that it's a vaginal ring whereby it's put in the vagina for up to 3 weeks, and on the 4th week when you remove it is when you get your bleeding, which mimics your periods. The benefit of this is that for women who find taking the pill every day a hassle, this is very easy because it's inserted and you can just totally forget about it, and it exerts its birth control effect as long as you use it for 3 weeks and 1 week off. Some women have a bit of concern thinking that it would be uncomfortable, will it drop off, how effective is it? Contrary to many beliefs, it's actually quite comfortable. Once it's been inserted, you don't really feel it at all, and there's very few cases reported of it dropping out. The other method of contraception, which also contains hormones, are a patch, which is like plaster, where you can either put it onto your arm or at your back. And this is also good for women who find taking the pill every day a hassle, because you just plaster it on for 1 week, change it every week for 3 weeks, and on the 4th week, whereby you are patch free, is when you have your bleeding, and that mimics your periods. Similarly to the vaginal ring, this may be more suitable for women who may be a bit queasy about inserting the vaginal ring, so this is just a plaster. The only downside to it is that maybe in our temperate country, the weather, it's warm, and when if you're an active sports person, whether by perspiring will it interfere with the patch contact on your skin. That's the only concern that we have. Otherwise, it's as effective as all the other methods of contraception, birth control methods available in the market. The other hormonal containing birth control method is what we call an injectable or a depot. What happens is you get these injections in the interval of about 2 to 3 monthly. It contains one hormone only, and it exerts. That's how it interferes with the cervical mucus and ovulation, and exerts its birth control method. The downside to this is that you may experience no periods at all if you're on this method of birth control. And the other concern is that it should not be used for more than 3 years because of its interference with bone density. What happens is when you do not have your periods for a long period of time, the density of your bones are actually reduced, and so this method is actually not recommended for more than a period of 3 years. The other downside of this method is that we find a very slow turnover of your fertility once you stop this. Some women have to wait right up to 6 months before they actually see their periods more regular, and they can start trying for a baby again. So I would actually not really recommend this method of birth control because there are so many more other choices available in the market. The other method that is available is the intrauterine device, which is the IUD. Also known as the IUCD. There is the copper containing one and the progesterone, which is the hormone containing one. Both are as effective up to about 97%, and what you require is actually to see a gynecologist, and he or she inserts it by a very small internal examination. And many of these devices are, depending on which one you use, can last up to 3 to 5 years. So it's as effective as about 97%, and this method is really useful for women who find taking the pill, as I said before, a hassle every day. So it's more of a long-acting type of birth control method. Of course, the other various methods that you have is like the emergency contraceptive pill, whereby it's also known as the morning after pill. If so happen you had sexual intercourse without any birth control method, if the window is within 72 hours, you may be able to prevent the pregnancy by taking a morning after pill. Although as the window widens, the effectiveness of the pill decreases. You can still try this method. It's not a very reliable method, but if you really have no other choice. These are all the temporary methods of birth control. Coming to the permanent method of contraception, there's just basically two. One is the male vasectomy, and second is the female tubal ligation. I'll talk about the female tubal ligation. What happens is the fallopian tubes are both tied, either through a keyhole surgery or a mini laparotomy or an open surgery. During a keyhole surgery, what happens is that both the fallopian tubes are either clipped or are either cut, and this also is similarly happens when we do an open surgery. If you had a cesarean section and prior to that you've already decided that you've completed your family, a tubal ligation can also be done in the same sitting. The benefits of this method is that it's virtually 99% successful in preventing a pregnancy, and it's a permanent method of contraception. So there is usually very poor results if or when you need to reverse it. So usually counseling is important prior to decision of embarking in this method of birth control.